I'm Dr. Robert Harper, fellowship-trained orthopedic spine surgeon here with Colorado Springs Orthopaedic Group, here today to talk to you about your neck. The neck is made up of 7 bones, C1, C2, 3, 4, 5, 6, 7, and all of the discs in between. And this allows your neck to move through several ranges of motions, flexion, extension, side, and then to turn your head. Most of the movement up and down occurs between your skull and the C1 joint, and between C1, C2, 60% of the motion is from side to side. The rest of the neck moves a little bit like this and a little bit like this. These are the nerves that exit on each side. Your spinal cord runs down through the tube here, and at each level the nerves come out these holes on the side. These go to the back of the head, to the shoulders, to the arms, and they control things like hand movement and coordination and fine objects as well as touch. A common condition we see here at Colorado Springs Orthopaedic Group is cervical radiculopathy, which is pinching of one of these nerves as they exit the canal. Whether through degeneration of one of these joints or a herniation of one of these discs, the nerve can get impinged, and that causes numbness or tingling that travels down the arm, or pain that travels down the arm, or sometimes weakness. Other more serious conditions include pushing of the disc backwards into the canal where the spinal cord is, or arthritis that's caused disc collapse and pressure onto the spinal cord, which causes a condition called cervical myelopathy. And that is numbness of the hands, weakness of the legs, clumsiness or coordination issues. That's something that we address very quickly with a surgery to relieve the pressure on the spinal cord, as that can get significantly worse. For cervical radiculopathy alone or a disc herniation, often we can start with conservative means. We usually start with physical therapy to allow the nerve to move more freely. We can perform injections where the nerves exit, or sometimes in the back in what we call the epidural space, to relieve the inflammation and make the nerve feel better. In extreme situations where people don't respond to conservative measures, we can go through the front of your neck, believe it or not, and take the disc out, put a spacer in with plates and screws on the front to stabilize this segment, and fuse that segment, which means having the bones grow together. That takes the pressure off the nerve. For younger people with disc herniations, we can also do a cervical disc arthroplasty, which is a disc replacement. And that's where we take the disc out and place a metal and plastic prosthesis in there, which allows native neck motion and helps prevent this adjacent segment degeneration. In certain situations where going through the front of the neck is not possible, we can also go through the back of the neck and remove this shingle of bone back here to relieve pressure on the spinal cord.